Hello. I wanted to give you another chance to hear about what Lyme disease can do to your body, how we treat it, how we test for it, how we manage your care through that process, and give you a little better understanding. We understand that when a patient comes in and we are presenting a diagnosis that carries a lot of baggage in terms of, oh, what does that mean? Because you've read a lot on the internet, you've read a lot of things or heard a lot of things from friends, and you want to know, what does it really mean? What's the true story about Lyme disease for me? Because I'm the one that has it, and I don't care what the internet says. I want to know what this means. So to help you have a little better understanding and give you several more minutes than we have when we are talking about so many other things about your health, when we've got so many tests, and even though the visits are longer, it's still sometimes a bit of work to get everything in. So what I wanted to do to take this video and walk you through. So today you had a diagnosis of Lyme disease. Lyme disease is a bacteria caused by a bacteria that is a spirochete. It's a little spiral form, but it can also live in round bodies, cyst forms, spore forms, and other forms that we're not sure about. But what this little bacteria does is cause a lot of havoc in our bodies. When you look at the list of potential systems, it basically is a textbook of medicine. So if you think about the fact that its cousin, syphilis, a bacteria that we know a lot about from years and years and even decades of study and millions of people infected with it, syphilis can affect every part of your body, every part of your system. Well, Lyme disease, being a spirochete also, is very similar, meaning that you can have pretty much from head to toe. You can have, most people know the skin, rashes. You can have neurologic symptoms, headaches, meningitis, neurologic changes where you just have pain, numbness, tingling, Bell's palsy where you can't move part of your face. You can have changes in your mucosa where there's rashes there. You can have increased allergies, so you have more sinus issues. You have increased gut permeability or dysbiosis, meaning that chemicals and foods cause more trouble in your gut, triggering things like irritable bowel syndrome. It can cause severe fatigue because it disables your mitochondria and makes you much more tired. It interferes with your limbic system, your emotional system, so you may have fluctuating moods. It can also change your hormones, another thing that affects moods, but it can lessen how much hormones. It can lead to inflammation that then leads to things like polycystic ovarian syndrome, where you have lack of periods, or you may have more hair growth for women. So it can also cause some issues with infertility, irregular cycles, or even missed cycles. For guys, it can lower their testosterone and cause some trouble there as well. It can cause, again, GI issues. It can cause heart issues if it's affecting that and causing arrhythmias. It can trigger allergies that trigger asthma. It can cause a lot of joint issues, gets in the connective tissues so that your joints hurt. They can swell. They can also disrupt your immune system. It can make your immune system weaker, so you're not attacking infections like yeast, Epstein-Barr, or it can also cause you to have autoimmune disease. So it could be that you're triggering Hashimoto's, antinuclear antibodies like for lupus. So it can do a lot of different things, and there's a booklet that I will usually upload for patients who have mold or Lyme in your portal where you can read more. It's about mold, but really almost anything that it says mold, you could put Lyme in there, especially when it comes to the symptoms. So a bacteria, they can affect just about every part of your body. You typically get it from some type of insect bite. Most people know ticks are an issue, but probably fleas, mosquitoes, bed bugs, and other things can. There's also a possibility it can be transferred from mom to child inside the womb. Not as often as we know happens with syphilis, its cousin, but it probably does occur. And I've seen a couple of times where I think that's how the child got that, because they probably had not been bitten by a tick. It also may be spread by blood transfusions, but that's pretty unusual. So with that, what we're looking at is a bacteria. They can affect any part of the body, It can cause all kind of a myriad of symptoms, so it's hard to know, does that person in front of you have it? So we use some testing. So one, a history. Have you been exposed to ticks? But even if you haven't, people don't remember having a tick bite. Then we do a history and then labs. So with those labs, what we're looking for is your body reacting in a way that indicates there is a Lyme infection there, and then looking for specific testing that says, yes, you're making antibodies to that. We'll use a standard test called a Western blot. We don't start with the ELISA, E-L-I-S-A, that standard medicine does because it misses a high percentage. It's not very sensitive. We want something that's going to pick up those to make sure we treat everyone that has Lyme as actually having it. So with that Western blot is a good start. Insurance covers it. Even if you pay for it, it's only $30-some. And we often find out. I've diagnosed people with that on a regular basis. However, if that's not clear, the suspicion is high, or it doesn't meet the CDC criteria, sometimes we'll do more advanced testing that expands the number of antibodies we look for, looking for things like band 31, 34, C6, VISE1, using PCR to see if we can pick it up there. Sometimes the immune system is so weak that it may not show up on that screening test by Quest or LabCorp. From there, we also are wanting to look a little broader range of other types of Lyme, meaning not just American, but also look at European and Asian. The standard test doesn't always pick up the European and the Asian version. So after that, we're going to have a diagnosis, whether it's by the standard test or by the more advanced testing, and we're going to say, yes, we believe you have Lyme disease. And then we're going to look at, are your specific symptoms, that list we talked about before, fitting? If we're telling you that you have Lyme disease, yes, we believe that is behind your symptoms. May not be causing 100%, but it might be causing 70, 80, or 90% of those. And even though those that it's not causing directly, it might be causing the disease that opens the door for those symptoms. So with that, we're going to start talking about treatment. We've gotten diagnosis from testing and history, and then we're going to talk about treatment. So with treatment, there's 100 different ways on the internet. Anything from zapping yourself with electromagnetic waves, using magnets, using all herbals, using nothing but a short course of antibiotics. Here's the way I approach it. Yes, there may be some truth to some of these other electromagnetic machines and so forth. My approach is going to start with taking the best of natural and conventional medicine. Natural, just some different herbs that help kill Lyme, things like garlic and a product we use called biocidin, but we're also going to look at things like artemisinin from wormwood. However, we don't want to throw away antibiotics, things like azithromycin, amoxicillin, sometimes doxycycline. There's some cephalosporins. There's a lot of people using something called disulfiram that may or may not be needed, but we want to use the best of both of those. Now, before we even get there though, we want to make sure your body is strong enough to fight Lyme. You see, Lyme is stronger than your immune system. We want to boost this up so when we knock the Lyme down, your immune system can finish it off. No matter what infection you have to get your body stronger, or otherwise, if you bring this down, it will just wake back up if your immune system can't finish the job. So you need a closer. So we're going to do things, move toxins, which some of those come from Lyme. So we're going to start with some detox. We're going to start with some nutrition, might be zinc, vitamin D. Dealing with gut health, we may need to treat some gut issues because some of the therapies can be a little rough on the gut, and get you ready so that way when you do the actual therapies themselves, especially if those include antibiotics, you're ready and we're more successful and you have less side effects. Then when we start that treatment, what we're going to do is do cycles. The first one is going to be an 8-week course of natural and pharmaceuticals. Take a week or two break and then come back and do another 6 weeks. When we start that first 8 weeks, we stage things in, adding one thing per week. That way, if you have a reaction, we know which therapy caused the problem, because a lot of Lyme or mold patients will have reactions. But the second time, once we know what worked and what you tolerated, we will start everything at once and do 6 weeks. With that, we do that course because we're killing Lyme any bacteria is easier to kill when it's growing. Lyme grows really slow, so you have to do it over a number of weeks. And we step back, give it a break. It starts growing again like weeds, and we come back and knock it out again. We do that at least 2 times to begin with, but then after that we determine, based on someone's symptoms, do they need a 3rd or 4th or even a 5th or 6th round. And we'll come back, check on you using labs. Not only are you feeling better, but are your labs improving? Whether that's a C4A, TGF-beta, CD57, and want to make sure that you're going in the right direction. So a lot of monitoring, first with symptoms, then with labs, until we say, yes, this is under control. We fix those things that Lyme is causing. Your symptoms are better. We fix the secondary issues, whether it's yeast, whether it's Epstein-Barr, whether it's getting rid of toxins. And we believe your immune system is now on top of the game and can get rid of Lyme. And then your last question, can we ever get rid of Lyme? Probably not 100%. Lyme, like many infections, I believe we are finding out more and more infections stay around in our body longer. We're knocking it down enough to where our body can keep it under control. But yes, 5, 10, 20 years down the road, you could have some of those symptoms come back, except you know what they are and you know how to deal with it, and you do it quickly, and they don't cause the kind of problem they did that may have left you with years of illness. Now, I want to reemphasize, we start with detox, get your body ready. We do a little detox, we slow down the detox, but do that along the way. We treat and kill, and come back and make sure that we heal up all the damage that Lyme did in the first place, and then help you know how to keep it from coming back. With that, is that different than conventional medicine? Yes. They believe 2 to 4 weeks, unless you have heart or joint issues, is enough. They don't believe in chronic Lyme that sits around there for years, despite the fact studies have shown that Lyme can be in the body years, months and years after treatment, and the toxins it makes can also stay in there. So we want to help patients live healthier, more abundant lives. We want to help you live that and overcome the Lyme disease that we have diagnosed you with. Hopefully this video helps explain things a little better, and I look forward to any questions you may have by sending those in the portal, and we'll help you get through this. It's going to be a learning journey besides a healing journey, understanding how your health, how disease has affected you, and how your health can be restored. Thank you for listening to this, and I look forward to your questions.